all done. Now, lifestyle, we have obesity. We want to decrease obesity because it's a risk factor for a lot of other things, so that decreases total morbidity. And it also decreases blood pressure. Off the top of my head, some of the reasons this would be that a decrease in your fat levels will also decrease your insulin, as obesity causes insulin resistance, and high levels of insulin, so a decrease in insulin, will also lead to a decrease in sympathetic nervous system, and will also decrease RAS, and therefore decrease blood pressure. So that's how obesity works. It probably works in other ways as well to decrease blood pressure, and works in lots and lots of ways to reduce morbidity and mortality. As obesity is the cause of other things like diabetes. Okay. Another thing we'll talk about, I'm running out of room here, smoking. So, decrease in smoking, therefore will lead to a decrease in sympathetic nervous system, therefore decrease in blood pressure, just how we talked about before. Alright, smoking, yep, and it also less endothelial damage equals more vasodilators and less vasoconstriction. This is a possible mechanism, and that's going to also decrease your PR, therefore BP. Okay, so that's smoking for you, and of course decreases your overall mortality. So, other one is decrease caffeine. Here's a little one, and that similarly works, just sympathetic nervous system. Caffeine increases the rate of your heart rate, so decrease heart rate. So that's where that can help. So other lifestyle measurements that we look at are also decrease in salt. So you can imagine if your kidneys are not working correctly and not excreting salt very well, then they're also going to have trouble. Sorry, let me start again. Water follows salt. If you have more salt, you're going to have more water. That's if your kidneys are not working correctly or at 100%. So if you decrease the salt, that decreases the work on your kidneys and will hopefully mean that you're going to excrete more water and have less fluid. So, fluid volume. Other lifestyle measurements that we look at are things like stress. Decrease your stress. A possible mechanism is that will decrease your sympathetic nervous system, therefore decrease heart rate, contractility. There we go. Thing I haven't talked about is alcohol. People on alcohol, I have trouble spelling. Alcohol needs insulin to be metabolized, so the more alcohol you have will also increase your insulin, which, as we talked about, insulin has its own effects on the sympathetic nervous system and RAS. That's if you drink a high amount. And also alcohol also leads to obesity. Okay, the only other one lifestyle I should talk about now is exercise, where that fits in to reduce hypertension. For one, it reduces obesity. It also increases insulin sensitivity, and it's also increase overall health. And regular exercise is known to help with blood pressure. So that's it for the lifestyle factors as well, and it's just a really quite a short kind of overview just to sort of remember some of the basics behind it.